roof, I have removed the lateral wall so that you can see the contents inside. Okay, so let me write it down. This is your anterior wall. This is your anterior wall. This is your posterior wall or roof ho gaya. This is your medial wall and this is your floor. This is your floor over here. Okay, so these are the important things which you need to know. Now apart from this, what do you need to know? What is this part over here? This is your mastoid bone. ये वाला जो bone है ना यहाँ पे, this is your mastoid bone over here. Mastoid bone, and near the mastoid bone, if I draw a process over here, that is your styloid process. Styloid process. Okay, and between the mastoid bone and styloid process, you see a foramen over here. Foramen between your styloid process and mastoid. This is called as stylomastoid foramen. Stylomastoid foramen. Stylomastoid foramen. You might be thinking, अबे पता है ये सब क्यों बता रहे हो? Why am I telling you is, at every level there is a facial nerve injury. Sometimes they will tell you facial nerve injury at the level of stylomastoid foramen. What will be the clinical manifestations? So you have to know individual parts. Or in few minutes I'll also tell you there are nerves that are exiting out of this stylomastoid foramen. You should know what are these nerves. So that is why I'm just preparing you the anatomy. Okay, so step by step I'm teaching you. This is the main reason for that. So we are done. We have discussed enough anatomy over here. Lacrimal ho gaya, pterygopalatine fossa, you understood maxilla, pterygoid plate. ये वाला part थोड़ा ज़्यादा concentrate करना, because this is the part where most of the nerves enter and exit. ठीक है? Mastoid, stylomastoid foramen and styloid process. Okay, so till here I hope everyone is clear. Okay, now after this the next important part which we shall be discussing. अभी यहाँ पे ना there are two important dots which you can see. ये देखो, there is one dot in this fossa, pterygopalatine fossa. Okay, pterygopalatine fossa में जो ganglion दिख रहा है यहाँ पे, what is this ganglion? Pterygopalatine ganglion, right? So what is this ganglion over here? I'm just writing it as PPG. Okay, PPG मतलब pterygopalatine ganglion. अभी यहाँ पे जो ganglion है, all of you just look here, there is a ganglion at the turning point में एक ganglion दिख रहा है ना यहाँ पे. This ganglion which is at the turning is called as geniculate. ये तो मोटा हो गया. Okay, so this is geniculate. This is your geniculate ganglion. What is this? This is your geniculate ganglion. What do you mean by genu? Genu मतलब bend. ठीक है, जहां पे bend है वहां पे ये ganglion है, so you call it as geniculate ganglion. So I hope this is basically clear to all of you, right? Now, once after discussing the anatomy, take a break. So we were discussing regarding this particular part. Okay, we were discussing what did we discuss? We discussed the basic anatomy over here: internal acoustic, medial, floor, anterior and posterior here, right? And I hope all of you know this is your internal carotid artery. Okay, now next important thing, one thing I just forgot to tell you over here. अभी यहाँ पे guys, you see a canal over here, है ना? This canal over here is called as your pterygoid canal. ठीक है, याद रखो बस. Okay, I'm not writing it. ये canal का नाम है pterygoid canal. Okay, what is this? Pterygoid canal. If you want, you write it in your notes. Okay, anyways, I'll write it in the next picture. So now first what we shall discuss, first step by step, we first discuss this red color fiber. Red color fiber कौन सा है? Motor fiber. What is that? Coming from facial nerve proper nucleus. First we will discuss that. Then next we will discuss the remaining fibers as well. Okay, so first let us discuss about the course of the somatomotor fiber. Now if I zoom into this, from where is that somatomotor fiber coming out? Okay, guys, before that I just wanted to tell you one more important thing which I missed. I'm really sorry, I missed one thing, that यहाँ पे ना